Welcome and good day. Thank you for joining us. My name is Russell Hendrickson. I'm the CEO here at Practical Data Solutions. It's great to have you joining us for today's webinar. The timing is never good, quantifying the ROI of improving analytics. And I'm so pleased to have joining me today, Scott Everett.
Welcome, everybody. Thanks. I'm Scott Everett. I'm the Vice President of Healthcare Solutions here at PDS. For those of you who are unfamiliar with PDS, we are an analytics company who have been around for well over 25 years, helping clients with visualization, analytics, data warehousing, and really helping to deliver a measurable ROI for analytics.
Throughout today's webinar, if you have questions, please feel free to chat them in using the question Q&A bar in your webinar toolbar. So today's webinar, the timing is never good. We recently heard this from a medical administrator who was speaking with our national sales manager and said, the timing is never good to think about improving analytics. But if we don't do something today and start looking, we're never going to get to where we need to go. And I thought, what a great, title for a webinar that we could share with you and talk about the ROI of analytics and why you should be looking at improving your analytics today so you get exactly where you want to be.
Yeah, it's really difficult sometimes to start these analytics projects because we have so many systems out there and so much technology that we're working with that it really creates a lot of data. And that data really sometimes is kind of a mess sitting out there. And of course, what everybody wants is a magic button that you would put in place and it makes it nice and neat and organized. But it's really difficult to get there. And that, of course, is not how really this works.
Yeah, so there's no magic button. What it really takes is good data modeling that's then structured, and ideally users want the ability to have both visual dashboards they can slice and dice through, the ability to use cubes to quickly and accurately get answers, and then of course to be able to report at the detail level, down at the procedure and down at the patient level. So let's go ahead and take a look at a visualization and try to get an understanding of what exactly it is that users want when it comes to analytics.
Yeah, and the power of analytics these days is the ability to visualize and see certain things like performance to budget and just be able to have it immediately right in front of our faces, to be able to look at salary benefits and find our largest expense categories, and then of course look at the overall profitability trends of the organization. And of course the technology makes this available, but you've got to start somewhere.
So our former President Obama said, change will not come if we wait for some other person or some other time. We are the ones we've been waiting for. We are the change that we seek. And I think that's just such a great thing to think about, right? We can't wait for somebody else to do it. We've got to go do it ourselves. And when we think about analytics and we think about quantifying, why would we change or why would we improve or why would we enhance the analytics? Well, to me, really the question comes back to, can we get an ROI where we do 20% of the work or 20% of the cost, but get 80% of the benefits? The old Pareto principle. And I think that so applies when you think about practical solutions to moving your analytics forward. But let's actually talk about calculating that ROI.
Yeah, so when we look at calculating ROI, what we want to do is we want to look forward and say, what are the gains we're going to receive from this investment, whether it's analytics or really anything else. And then after we take out the cost of the investment so that we see the profitability of it, divide it by the cost of the investment, that's going to give us a percentage of ROI that's out there. So when we look at calculating this ROI, the reason we want to do this and project forward is we want to start looking at where are we seeing a potential for a significant ROI? Because when we see those projects that have the potential for great ROI, it's no longer an if we're going to do that project. It has to become a when we're going to do that project. It's costing us too much money, or we're leaving too much money on the table by not doing it.
Yeah, another interesting point about calculating ROI is research shows that in particular with IT projects, when the ROI is a focus, we're doing this project, we're expecting to get a benefit out of the project, the likelihood of success is, significantly higher. So when you think about that, delivering an ROI with projects, the way you can go about doing that, best practice would say, make sure you understand the value of the ROI before you start, anticipate the benefits you expect to gain, calculate the expected ROI, and then of course, measure the results, making sure that you're getting those benefits. We'll talk a lot about additional benefits when you measure projects, thinking about the ROI, that a lot of times unanticipated benefits may be as great, if not greater, in your ROI result.
Yeah, so of course, we talk about got to begin somewhere, and Lao Tzu says the journey of 1,000 miles begins with one step. Same with my workout every morning. It just begins with that first step, but that first step sometimes is always the hardest.
So the first client that we're going to look at had two dashboards that were being built manually in Excel, and it was taking about 16 hours per month for about a 70 physician medical group. So the primary benefit and the reason they were looking to automate was to try to move that from 16 hours a month down to less than an hour a month to complete the two reports. Additionally, they felt if they had better software, they could also generate other dashboards and maybe even start doing some reporting weekly or even daily. And also in the process, by automating, should be able to reduce errors, resulting in significant additional savings per month.
Yeah, so a lot of times we don't think about the ROI that comes from automation, but the automation and the manual reporting process really can be fairly significant when you look at it. It takes a long time to collect all of the data, to copy and paste it into separate reports that are out there. But even when you're looking at that, it goes beyond that, where you're looking at, all of this copying and pasting and doing it multiple times. It becomes prone to errors where you're copying the wrong data into a spreadsheet or pasting into the wrong cells, things like that. And of course, we're not even talking about how to deliver the data. So there's a lot that can be corrected simply by automating as much of this process as you can.
Yeah, and so many of our customers already know this, but if you're not familiar with PDS, we have a tool set called PDS Dash that does just that. It allows you to take a fairly manual process, leveraging your current analytics, pushing out reports and automating the blending of data and the refreshing of reports and even the bursting of reports for physicians. And that was the tool set that we brought into play here.
Yeah, so once this automation's in place, you can actually even take your dashboards and make them more visually appealing and easier to look at. So you can see an example of a dashboard here that was created simply by automating Excel, showing a provider their charges, payments, adjustments in a given month or year to date, showing revenue trends over the year currently, and then of course maybe giving them some supporting data behind it like coding curves or payer mix and things like that.
Yeah, and I want to point out that this dashboard doesn't have any RVUs on it. That was in part because this specialty practice didn't really use RVUs for physician productivity, but obviously RVUs could easily be added into this dashboard to highlight how the physicians were performing. The second dashboard that the organization was building was a P&L that primarily broke down the revenue and expenses by department. And so one of the things that the organization was able to do by automating and continuing to use Excel, they were able to build in sliders into this dashboard. So it was very easy not only to refresh the dashboard and have it updated, but also they could now deliver it where the administrators could click through and change the data they were looking at.
And I'll tell you from the standpoint of being a former executive that way, being able to scroll through in a single file is so much nicer than having to open a bunch and look at them that way. All right, so let's take a look at how we would calculate this ROI then. So when we were working with this client, we looked at the staff salary and benefits and overhead and determined it'd be about $50 an hour for a staff savings. So when we saved 15 hours a month times $50 an hour is about $750 a month in savings that way. But then we had the additional benefits of creating new dashboards and additional reporting capabilities that came from this. It saved about another 40 hours of staff time. So that was about another $2,000 a month in savings. When we look at the upfront investment, which was upfront training costs of an implementation about $4,400, as well as $600 a month for the software license. When we calculate that ROI, we can see that, first year total gains are about $33,000. First year costs are about 11,600. So when we take and throw that into our calculator, that's about 185% ROI.
Yeah, and what's so interesting is, even at 50% of the benefits or even at 20% of the benefits, it's pretty easy to quantify and say, this was a good decision to make, right? Not to mention the second year ROI, where now the tool's in place and you're able to continue to produce more information. ROI, as we'll talk about, tends to be rather low when it comes to just focusing on automation. So, we're not even really talking about the benefit of the organization being able to manage more effectively by having better data. But we're going to talk about that next. You don't have to be great to start, but you have to start to be great. Zig Ziglar.
Yeah, so the next one we want to look at is another one that is automation, but this one's for physician compensation. And the thing about this particular dashboard is for physician compensation, you cannot have errors. There's a lot higher level of security. There's a lot higher level of scrutiny. There had to be a lot of additional time, not just in creating these dashboards, but making sure that we were checking them and going through them and making sure that they were absolutely correct. And then it took another half day to send it out because you can't send the wrong ones out either. You had to make sure that you were doing everything exactly right. So what we were trying to do was, again, get this down so that the creation of these dashboards was less than a day. And then we needed to use automation to eliminate manual errors altogether, publish these dashboards online so the physicians could get to them whenever they needed them.
Yeah, and some of the other benefits, of course, were the ability to do what we talked about in case study one, having better reports so the physicians could manage productivity. Having more information, making it more visual, so it was easier for the physicians to understand what was going on. So by sort of tackling the main challenge of physician compensation, they were then set up to take advantage of everything we talked about in the first case study as well. So let's go ahead and look at a sample compensation report. Now, this is a PDS example here, but I think it's a good illustration of the kind of things that the automation can do. On the left side of the screen here, you can see we have this organization's a sample of what their organizational comp looked like, where they had their monthly RVU production. It's pretty easy to see how the physician is performing for each tier. We can see a projection of where the physician's going to end up. And so therefore, we can even do a projection as to what their work RVU-based compensation is going to look like. Additionally, then we have all the calculations that even explain how much is the physician earned through the quarter and how much are they due. So that left side of the screen, being automated, but also fairly easy to follow, made it easier for the physicians to understand what was going on.
Yeah, and what I also like about this from a physician standpoint, looking at it, it's not just giving them what their projected calculations would be, but it's also giving them some supporting information that goes along with it so that they can see, help them self-manage where they're going to go. Do they need to increase their RVU productivity to get to where they want to be? Do they need to work on any sort of patient satisfaction goals that may be out there, or helping the physicians to focus in on the clinic goals as well and help them to know their part in helping the overall clinic or organization meet the goals that they have set as a practice. So again, we talked about not just the automation of the creation of these dashboards, but the automation of the delivery and putting them up into a secure web portal that PDS has that allows the physicians to go in and get just the reports that are theirs. They log in and the reports are sitting out there. They can click on the reports and they open up for them. They're also able to access any sort of organization-wide reports that the practice sees fit to put in their portal as well.
And so in this case, the ROI of just improving on the physician dashboard alone, was about 76%, which you might say, well, that's not, extremely high. But the goal here was not to fully automate compensation. It was just to try to reduce the errors and the time that it was taking and make dashboards more visual. That was sort of the main goal and the benefits, which they clearly achieved.
But the great thing about publishing dashboards like these is, like I talked about with the ability to self-manage, when physicians see where they sit from a compensation standpoint and are able to go in and say, if I can increase my productivity, I'll make more. If we look at it from that standpoint, if just 20% of the physicians looked at these reports and increased their productivity by 5%, now all of a sudden our ROI jumps up into the 650 or higher level, just with about a 2-month break even on this investment. So it's really interesting when you look at analytics, because a lot of times we look and say, well, it's just saving us time, or it's just, making this data more accessible. There's not really a hard ROI that comes with that, but that's not necessarily true. How do we find how ROI can be calculated? It comes from any sort of increase in revenue productivity that you may see. If it makes you more profitable, makes you more efficient, increases your patient satisfaction. Reducing costs we talked about through the process of automation is there as well. But also looking at how can we use this to help create strategy? How can we use it to more accurately look at the data that we have? And instead of spending all of our time trying to pull the data, format it, and get it out, we're using that time to formulate strategy, to put in place new processes, to get the practice more in line and give us insights into where there are opportunities for higher performance.
One of my favorite visionaries, Walt Disney, said the way to get started is to quit talking and begin doing.
So let's talk a little bit about how we can achieve some of these goals through self-service analytics for leadership that's out there. We worked with 100-physician practice. They had no self-service analytics. What they had to do was they had to formulate a report request, and they had to send that to their IT team, which would take 2 to 3 days to write the report, send it back to them. They had to make sure that it was formatted the right way. They didn't necessarily always get the information that they requested, or it wasn't the right way, or wasn't in the right format for them. So a lot of times they were just making decisions because they didn't have time to wait for the data to come across. So what we were trying to do is let's get the leadership to be able to do 80% of their own analytics on a self-service basis, be able to have a simple and easy tool to use. And then we could have routine reports that are delivered automatically. We can look in and say, whenever questions arise, we can go in and do the slice and dice to help identify outliers and get that analysis into the hands of people like that, and manage information on a much more timely basis. So again, when we look at these analytical components out there, we've shown you a few things where we talk about with the visualization tools. And as an executive, you want to be able to go in and look at the data, see trends, see percentages, be able to digest things very quickly. But again, a lot of times questions come up from these visualizations where we want to be able to go in and do further analysis. And in order to do that, we want to be able to utilize cube technology. Which allows us to slice and dice and get results in seconds. And then, of course, if we need to be able to get down to the individual transaction and patient level detail when it comes to that.
Yeah, so we were able to bring in the PDS Empower solution that really does all of the things, Scott, you just mentioned, the ability to have, very dynamic visuals that are sort of available, interactive dashboards where you can just quite simply point and click and change data and start to understand what's going on. And then, as you mentioned, being able to drill right into the dashboards, right into the cubes where I can continue to do point and click, drag and drop analysis, and even then drill all the way down to, that procedure level detail, that transaction level detail. So if I want to see the Blue Shield charges that were done by Todd Allen, I can literally just click, and the tool is going to write the query for me. I don't have to go ask somebody for information. So here I am in a single tool set that does everything from visual to slice and dice analytics to being able to analyze charges, payments, and even down at the patient level detail. And that's what this organization needed, was really a robust tool set that allowed users to self-service.
Yeah, and so how do we calculate the ROI of that? Well, again, we look at the time spent that's doing it. If we have 20 people who are requesting data out there, and between the time it takes them to request the data, to have those reports written and sent back, and then check the data, send it back, have it rewritten, etc., you could say there was almost maybe 6 hours of request. And if we had 80 requests at 6 hours per request, $480 or hours per month. I mean, we're looking at $6,500 just by allowing people to access their own data and do self-service analytics. But that doesn't even touch on the intangible benefits of people being able to do and make better decisions by having this data right in front of them.
Robert Kiyosaki said, "Your future is created by what you do today, not tomorrow."
So let's take a look at another case study. You talked about the future there, Russell. This is definitely an emerging issue in a lot of practices where how to look at our patients with chronic conditions and how that works with the value-based contracts that we have out there through calculation of HCC risk scores. And the client that we were working with had knowledge that there were gaps out there with the payer scores because they were just waiting for the payer data to come back. And they didn't really have a way to reconcile that or go back in their system to calculate and see if the pairs were correct in that. In addition to that, they didn't necessarily know if they had the best processes in place to manage these populations. They didn't really have a handle of their overall practice populations. And so they wanted to be able to get a better grip of that as well. So what we wanted to do was calculate these risk scores internally, be able to go back to the payers, reconcile with what we know is going on within the practice compared to what the payer is sending back to us. But in addition to that, we wanted to be able to go in and better manage how we work with these patients that are higher risk patients, be able to provide them with better care, have better outcomes, help us manage our own patient access that comes with that, and just basically have more timely and better information for us to manage these care gaps that existed. Now, the problem that I think a lot of people have when they look at HCCs is they think this is all in the payer's hands. That what's happening is the payers are getting data from the EHR, that data's headed over to the payer, and they just calculate the risk score and send it back to us. And that's not what's happening. What's happening is that we're taking the data from the EHR, we're sending it to a coding team. The coding team is putting in the diagnoses, the ICD-10 codes. They're sending it to the billing team, which is dropping it to a claim. The claims are going to a clearinghouse, which may take and strip off some of those ICD-10 codes that are going into these calculations. They're sending that on to the payer. The payer takes what it looks at, determines if the claim is going to be paid or rejected, and if it's going to be adjudicated, they'll take those adjudicated claims and calculate risk scores. Every single process that you see on this slide right now creates a potential for a fail point in not getting complete and accurate risk scores for your patient populations.
Yeah, and so just focusing in on the payer paying accurately, that was the primary benefit this organization wanted. And so what we're able to do was bring in a calculation of revenue capture risk scores by taking the claims data directly from the practice and calculating, what is the patient's HCCs by encounter? What is the total patient HCCs across the population? What are the patient's annual risk scores? And then being able to roll them up, allowing the organization to have the data they needed to manage both by payer and by population. If we take a quick look at a dashboard, we can now see who our high-risk patients are. We can start to point and click, similar to what you saw with the other tools, understanding where we have scores that maybe we didn't code correctly, or patients that maybe we haven't seen this year that need to be treated. But ultimately, we're working proactively to manage the risk scores, ensuring that when the payer comes and says, here's what you did, the practice was able to come back and say, no, we know what we calculated. We know what we sent you. We know where our data is right and where your data is missing scores. And ultimately, then they were able to reconcile significant dollars.
Yeah, so when we looked at the ROI of this particular project, the customer found that the payer's risk scores were off by about 15%. A lot of that came from either rejected claims, they didn't count the diagnoses that came across on those, even though the patient still had those diagnoses. It also had issues with the clearinghouse that were stripping off a lot of diagnosis codes before they were sending it on to the payer as well. And they were able to look at this, and it was about a $280,000 in additional revenue they were able to do by reconciling these risk scores and making them more accurate. The other thing that we looked at is when we wait for data to come back from the payers, we're only getting that payer population. We're not able to manage our entire practice population by looking at payer data. We need to be able to look at that and calculate it internally. And so when we're doing HCC revenue capture, 600%, 1200%. First year ROI is not at all uncommon, and it may be even higher when you factor in the additional quality and patient satisfaction and loyalty that comes from being able to manage with this information.
Yeah, Scott, you said it right on. By having good information, from a financial perspective to manage with the payers. Also, though, the significant benefit is that care teams now have this information and they're able to use it, to improve patient access, to improve scheduling patients, to follow up on patients that might be missing visits or risk scores. So really a huge ROI here and huge benefits.
So you never win if you never begin, is what Helen Rowland once told us. And so let's look at a case study that this one's personal to me. This is one that in a prior life was something that I struggled with quite a bit. And we started looking at denials and particularly denial recoveries. Now, denials is tough to report on. Denial data is difficult to get and it's difficult to put in the right stage. But we had a client that had monthly denial rates bouncing between 12 and 18%. They wanted to look at prevention efforts that were out there. But in addition to that, we found out they weren't even appealing a lot of the ones that they were getting. So we wanted to be able to look at having good information as far as the sources of denials, and help them to really get a hold of what's going on, not only from their denial volume standpoint, but also looking at what's happening after the denial so that they could start looking at recovery initiatives as well.
Yeah, so just focusing in on some key areas, the impact of denials on revenue, average claim denial rates run anywhere between 5 and 20%. And yet a lot of the data shows that less than a third of denials are appealed. Just recently, a study, actually, Scott, that you shared showed that Medicare Advantage was denying, in some cases, a significant amount of denials, and yet less than 10% were appealed. So it really goes to what's the impact, because you're expecting that revenue, but if you're not recouping on appealing, there's no way you're going to get paid.
Yeah, and when you talk about the appeals that come across, they were saying about 82% of those appeals were successful. So, really a lot of times that appeal can be something that's very beneficial to you. But looking at this, there's also a time value of money issue with denials that we have to look at, because it's not just we appeal it and it gets paid immediately. If we look at it, it costs us about $21 just to file a claim to begin with. So if we take that $21 and then the time it takes to get the appropriate documentation, make the corrections needed, refile that claim, it costs us about an additional $24, $35 to resolve a denied claim. And it may get denied again, in which case we have to go through the whole process. Basically, it gets to a point where if you have a claim with multiple denials and it gets resubmitted 2 or 3 times, it's costing you more money to chase after that claim than it is from what you're going to actually get if they decide to pay it. And if they don't decide to pay it, you just had those costs kind of thrown away. So we need to understand that there's a timeliness issue that comes into this as well.
The other area then, of course, is you're getting denied claims. How do we measure if we're actually recovering them? What is the real net denial rate after recovery, right? Because being able to quantify, we're getting denied, we're never getting paid, or in some cases we're getting denied, but we're always recovering. And that's a critical KPI to measure to really understand your performance. So again, when we think about analytics and having good data to be able to understand what's going on with denials, we want to be able to see denial trends. We want to understand where we're getting denials, being able to categorize denials. We want to be able to understand matched denial rate, so we can start to understand what is our true denial rate per month of the claims submitted, and then ultimately also measure what is our clean claim rate. So having good data, being able to understand the details behind the denials, what are physician impacted denials, are really critical. But let's focus, Scott, in on that. What is the opportunity if we really understand our denials and our denial recovery?
Right. And so the philosophy we like to look at is let's prevent where we can and recover where we can't. And so it starts by categorizing these denials to see who's at fault. Is it something that we're at fault with its registration or coding? Those are things that we have a lot of control over from both a prevention and a recovery standpoint. If it's payer denial or a patient denial, those take a little bit more time and effort to resolve. But we want to make sure that we're managing everything we can where we are in control. But then it begins to get deeper into that, where we start looking at what can we recover? What are the things that are getting recovered at a fairly high rate, talking about particular denial codes and payer combinations. And then what are ones that are just not getting recovered when we do it, especially if it's a high volume denial like we're seeing there. What are these particular denial codes? What's our risk for not recovering that way? And then, of course, we can even break it down to the individual CPT code level so that we can see how many times is this particular procedure being denied by which payer. And of course, if we bring in our fee schedules for those, we can see the actual dollar volume or value of what's at risk without, if we're unable to recover this, recover on these particular denials.
Yeah. So for this client, the solution then was to bring in a best practice denials management solution with analytics, like we've been showing, where really the three key areas was being able to categorize the denials, matching the denials to the charge period to understand what is the true denial effective rate and the true clean claim rate, and then being able to understand where we're able to manage and control recovery. How much of what we were doing was actually working with recovering denied claims.
Yeah, and so when we look at something like this, we talk about the hard and the soft ROI, where it's difficult to look at sometimes and say, well, what did we really say? But with denials, this is all hard ROI. This is all cash that falls to your bottom line. So a 1% reduction in denials, if we're reworking them, even just 1% for this particular group was about $18,000 over 6 months. When we started looking at their denial recovery, where they weren't even doing a lot, they were not only able to do more and be more efficient at it. And so this was an increase of $750,000 over 6 months. And again, this is not 750,000 estimate. This is actual cash dropped to their bottom line. If you get only 10% of that, it's a significant ROI. The ROI 12-month averages for improved denials is 600 to 1200%. It's significant. Even if this is all that you do, it more than pays for the analytical improvements that you're making.
Some of the things we hear, why would an organization not invest in analytics? We've seen a number of ROIs here, and you say, well, why doesn't it make sense, right? And so some of the things we hear is, well, we're going to build it internally. IT has this as a project, and they're going to go look to hire somebody, buy some technology. A lot of times the question though is, do we have a date for deliverable, right? Because if we could work with a vendor like PDS who's experienced and can commit to a deliverable date, now you can start to measure the ROI of building it internally versus how quickly and having a commitment for delivery. What is the opportunity cost if the approach we're taking is going to fail? And of course, a lot of times we hear, well, we're going to try to build it internally, but we don't have any experience. And now we've got to go look for somebody. Well, how long is that going to take? What's the cost of not having the information that you need? Change, of course, is just a big one. We talked about that. There's never a good time. And I think our answer today, Scott, would be you need to start today if you want to get to where you want to be tomorrow or in 3 months or 6 months. So just a couple of common objections that we hear. Let's break down those, Scott, because we've talked about this a couple different times. When we think about using analytics, right, and we look at sort of the basic usage of analytics, summarizing and trending data, as you saw through our case studies, the ROI tends to be rather low. It's still significant, but it tends to be rather low.
Yeah, so when we start looking at, just data summaries, trend analysis, we're just trying to put together reports because we don't have anything. There's still an ROI from the automation of these reports and being able to start getting to this data and analyze it better. We usually see 50 to 200% from automation. And then, of course, just having the data to improve decisions, we're at 150 to 300%. It's not the highest ROI, but it's not nothing either.
Yeah, it's usually significant, not to mention even the staff morale boost, having better tools and getting rid of some of the sort of routine re-automation, manual automation that organizations go through. But when we think about HCCs and denials and any of these other areas where we have better data, where we can start putting relationships of data together, this is where we see significant ROI. And these are usually the side benefits or the additional benefits that organizations gain when they think about automation. By bringing in better tools, they have the ability to benchmark data. They can now measure bottom performers and top performers at a click of a button. They can automate reports that then provide insights. And ultimately, they can even predict outcomes and changes. And that's really where you see just significant ROI.
So when you're starting to think about, well, when do I need to get started? What do I need to do? We're not really sure about what the ROI is. Don't necessarily look at it from the potential gain side. Look at it from what's it costing me to do it right now the way I am? And then say, is there a better way that'll save me money? If you don't really know if that people are seeing this ROI, get references, talk to the references, see how much better they're able to do things with improved or enhanced analytics, and find out what they were able to improve. And then, of course, maybe do a pilot. Maybe do a limited thing where, we'll take a single report, see if we can automate it, and then try to get a better understanding of the gains there. Because if that pilot works, then you can then expand those operations. So when we start thinking about the takeaways that we talk about, again, people don't look at analytics and reporting as having an ROI, but it really not only has an ROI, it's one of the stronger ROIs for improvements that you're going to see through any software improvement that's out there. Look at your analytics as an asset. It's an investment. It's not a cost. We're going to be doing things better. We're going to be making better decisions. And then if we start looking at, managing our reimbursement and our denials, it's a huge investment and something that we're going to get high returns on, and just drops to our bottom line. Calculate that potential ROI, reduce it to a minimum. Say, if we just get the minimum basis, what's our ROI? And I still think you're going to see profitable projects coming through from this.
Yeah, and certainly any reputable company can help you with calculating an ROI. We certainly can do that here at PDS. And the other best practice takeaway I would suggest is, after implementation, as you're starting to roll out and deploy whatever it is that you've set out to do, measure the ROI and use that to justify the ongoing investment in analytics. It's very easy when you can go to leadership and say, we did this project, we've got an ROI, we've improved process, and we have better data. Let's now take another step and invest a little more and continue to gain benefits as we move forward. What is not started today is never finished tomorrow. And I think that's such a great quote to sort of end our webinar today, but we will now take questions.
So if you have any additional questions, please feel free to submit these at this time using the Q&A toolbar. We'll be here until we have all of your questions answered. And thank you all for joining us today.